Actually, before we begin talking about the female reproductive system, I think it'll be a nice idea to describe the pelvic region a little bit, and this will actually help us to contextualize the topic a bit better as well. So, how about if we actually start with this little cartoonic illustration over here? What we are looking here is basically a cut section, a side-to-side cut section taken through the body, and you can see the abdominal pelvic region, abdominal pelvic cavity over here. The diaphragm can be seen at the top. These are the side walls of the body, and you can see the abdominal cavity continuing down into the pelvic region, into the pelvic cavity. So this is one uh, big continuous abdominal pelvic cavity. Now, where is the pelvis situated? Well, the pelvic region is the region which is in between the two hip bones, or the two pelvic bones here, and we can actually divide this pelvic region into a false pelvis at the top, which is actually the region between the two iliac fossae, and a fall and a true pelvis down below. Which extends basically from the pelvic brim, or the inlet of the pelvis, and extends all the way down to the outlet of the pelvis down below over here. So we can divide the pelvic region into a false pelvis and a true pelvis. The true pelvis contains in it a muscle which is known as the pelvic diaphragm, which you can see in this illustration here, drawn over here. That pelvic diaphragm then breaks up the true pelvis into further two subregions, which are the pelvic cavity proper at the top and a perineum down below. Pelvic cavity proper now extends from, it's a subregion of the true pelvis, which extends from the pelvic brim all the way down to the pelvic floor. And beneath the pelvic floor, all the way down to the pelvic outlet, is the perineum. Now, if you look at the same perineum from another angle, we can see the diamond-shaped boundaries of the perineum here, and you can we can mark out the structures which are forming the boundaries of the perineum. So we've got the pubic symphysis in the front, and anterolaterally on either side we've got the ischiopubic rami. Then we've got the two ischial tuberosities on the side here. Posterolaterally we've got the sacrotuberous ligaments, and then posterior edge is going to be formed by the posterior extent of this diamond-shaped perineum is going to be formed by the coccyx. Now, if you take a hypothetical line extending from one ischial tuberosity to the other, then with the help of that line, we can actually divide this diamond-shaped perineum into two triangles. We've got an anal triangle at the back where we can see the opening of the anus, and we've got the urogenital triangle in the front over here. Our area of concern is basically the urogenital triangle, because that's where the urogenital structures can be seen opening up as well. We can see the urethral opening in the front, and we can see the vagina opening at the back. So the female reproductive organ are going to open up over here in this region in the urogenital triangle, which is known as the vestibule, which is bounded on either side by the labia majora. And we'll talk about this in a bit more detail as well in the subsequent slides. Now, since we are talking about the pelvic, about the female reproductive organs, so I think it'll be a nice idea if we actually take the help of this cartoonic illustration, which is actually a mid-sagittal section taken through the pelvic region, and try to use this illustration to help us understand the relationship between the different pelvic visceras, or the relationship between the female reproductive organs and the other pelvic visceras. So like if you look over here, this is basically the anterior aspect of this illustration. Here we can see the pubic symphysis in the front and the anterior body wall shown over here. At the back over here, we can see the cut section, the midline sagittal section of the sacrum continuing down as the coccyx. Now, this is the pelvic region, and we can see three pelvic visceras being housed over here. We've got a bladder continuing down as the urethra. Then you can see the uterus right behind and kind of on top of the bladder, continuing posteriorly as the cervix, and it continues down as the vagina. And then we can see the rectum, which is eventually going to go down as the anal canal. All of these three visceras inside the pelvic cavity, they are going to be eventually continuing down through the pelvic diaphragm and then through this area over here known as the urogenital diaphragm. And once they pass through over here, they're going to be entering into the perineal region. And we talked about the divisions of the perineum into an anal triangle at the back and the urogenital triangle in the previous slide. And so we can see that nicely over here that the rectum continues down as the anal canal. That's going to open up in the perineum in the anal triangle region. The urogenital triangle is going to be that part of the perineum where the bladder is going to continue down and open up as the urethra, and the vagina is going to continue down and open up in the vestibule behind the urethra. We can see the thin hairless folds of skin over here, the labia minora or labium minus, which is then bounded by the labium majus, and that is the boundary of the vestibule in the urogenital triangle. Inside the pelvic region, we can also see the peritoneum, which is kind of jumping from the anterior body wall. The parietal peritoneum jumps over here from the anterior body wall onto the roof or the fundus of the bladder, and from here it then jumps over to the onto the uterus, and from the uterus then goes on to the rectum, creating two peritoneal pouches over here, which we will talk about later. And there's a huge clinical significance to knowing the existence of these pouches over here. We'll talk about that later as well. But that kind of gives you an idea as well that these pelvic visceras are covered over by the peritoneum. So they're basically extra, to quite an extent, they are extra peritoneal structures. Once again, we are resorting to a mid-sagittal section of the pelvic region to look at the relationship between the pelvic viscera. But what we've done over here, we've thrown in the parietal peritoneum into the picture as well. And this basically helps us understand how the peritoneum reflects from the anterior body wall onto the different pelvic viscera, creating different important pouches in the pelvic region. So the illustration here, if we start from the front here, the illustration here shows nicely the peritoneum covering over the fundus of the uterus. So this is basically a mid-sagittal section through the uterus, and you can actually see the uterine cavity inside as well. You can see the peritoneum covering over the uterus, and then it actually covers the lower part of covers the anterior aspect of the uterine body, and from here it then reflects onto the superior surface of the urinary bladder, or in other words onto the fundus of the bladder. This reflection of the parietal peritoneum creates a pouch over here which is known as the vesico-uterine pouch, and from here the peritoneum is then going to continue up on the under aspect of the anterior body wall. The peritoneum also can be seen covering the posterior surface of the uterine body. It extends a bit down over here to cover the posterior aspect of the cervix and the posterior part of the vagina over here, which is kind of enveloping the cervix and creating a little bit of a space over here called the posterior fornix. So the posterior fornix region of the vagina is also covered over by the parietal peritoneum. We'll talk about the fornices and the gutters in the vagina in our subsequent slides. So if you don't understand what that is for now, that really doesn't matter. We'll be elaborating upon this in a bit more detail later as well. So then from here, from the upper part of the vagina, we can actually see the parietal peritoneum then reflecting onto the rectum, creating another pouch over here, which is known as the recto-uterine pouch, or the pouch of Douglas. These pouches are potential sites of fluid accumulation. The fluid in various disease processes, the fluid actually passes down the paracolic gutters and then accumulates into these pouches over here. What you can see here is that the cervix, unlike the uterus, the cervix, with exception of its upper part, is not covered by the peritoneum, and the vagina is then covered over by the peritoneum posteriorly in its upper part over here. The rest of the vagina has no connection with the peritoneum. Right, so now let's take up the components of the female reproductive system one by one. And we will start with the vagina. The vagina, or the birth canal, is the part of the female reproductive system, or the part of the female genital tract, which extends from the vestibule down below all the way up to the cervix. The opening of the vagina lies inside a region which is known as the urogenital triangle, which we already talked about. And within the urogenital triangle, the opening lies inside a region known as the vestibule, which is the area bounded by the two labia majora, one on either side. The labium majus can actually be seen in this midline sagittal section over here. This is the region which is known where the opening, where the vagina can be seen opening into the vestibule. This area is known as the labium majus, and inside the labium majus we can see the thin hairless fold of skin, which is the labium minus. You're looking at a mid sagittal view, so you're looking at half of the vestibule over here, and vagina can be seen opening right behind the urethra into this vestibule region in the urogenital triangle. Right, the vaginal opening is posteriorly related to the urethral opening, and it's quite large in size as well compared to the urethra, and hence easily identifiable on the prosection. The outer vaginal opening is normally partly covered by a membrane which is known as the hymen. At the deep end over here, the cervix can be seen bulging into the anterior part of the vagina. The vaginal canal, you can see over here, travels upwards and backwards between the urethra in the front and the rectum at the back. This can be seen here in this illustration, where you can see the relations of the vagina. The vagina going up over here, and it's going to be punched in by the cervix from the front at its top end, and this vagina is related anteriorly to the urethra over here, and posteriorly it is related to the rectum. Near the upper vagina, the cervix can then be seen protruding into the vagina on its front surface at approximately 90-degree angle. So the cervix is basically anteriorly related to the upper vagina rather than superiorly related to it. And we'll talk about these angles in a bit more detail in subsequent slides as well. As the cervix protrudes into the vagina, it creates a kind of a space between the cervix and the vagina, known as the gutters or the vaginal fornices. So you can see a little space over here, and you can see a little space over here as well. So we've got an anterior vaginal fornix here. We can see a posterior vaginal fornix, which you can probably appreciate is much bigger and much more prominent as compared to the anterior vaginal fornix. And then there are two lateral vaginal fornices, one on either side, right and left, but we can't appreciate them because we're looking at the mid sagittal section over here. Now let's talk about the uterus. So the uterus is a muscular pear-shaped organ which is situated between the bladder and the rectum. Once again, we can resort to this mid-sagittal section over here, where we can see the relationships of the female reproductive organ. We can see the relationships of the uterus very nicely over here. You can see the uterus lying in between the bladder in the front and the rectum at the back. In fact, the uterus is kind of flexed anteriorly, and you can see it resting on top of the bladder, on the fundus of the bladder. Now, the uterus consists of various subparts. There is a part which is known as the fundus. Then we've got a body, and then a narrow region which is called the isthmus, followed by the cervix. If you look at this illustration of the uterus taken out of the pelvic cavity, you can see two uterine tubes popping out from the uterus, one on either side. We can use these uterine tubes as our reference point. The part of the uterus which lies above these uterine tubes, that is known as the fundus. Fundus therefore lies superior to the uterine tubes, and the part which lies inferior is the body. That is the main body of the uterus, which contains the uterine cavity. The body is flattened anteroposteriorly, so that the uterine cavity is a narrow slit-like space, and you can appreciate that feature much clearly in the mid-sagittal section over here, where you can see the narrow slit-like uterine cavity space over here, which is bounded anteriorly and posteriorly by the uterine wall. The cervix is then the inferior part, which is shaped like a cylinder. The cervix then projects into the upper part of the vagina. The part of the vaginal cavity which surrounds the cervix, that is known as these are known as the vaginal fornices or the gutters. We can see in the side to side section, we can see the lateral vaginal fornices much clearly. The anterior and posterior vaginal fornices are going to be much clearly visible. On the mid sagittal section, you can see the posterior vaginal fornix much bigger and prominent as compared to the anterior vaginal fornix. The cervix contains a cervical canal, which is basically a continuation of the uterine cavity. The cervical canal is bounded superiorly by an opening which is known as the internal os, and inferiorly it ends at the opening which is known as at the inferior opening which is known as the external os. The external os and the lower end of the cervix can easily be seen through the vagina as part of the vaginal specular examination. Right, so what is the normal positioning of the uterus? Well, under normal circumstances, the uterus is anti-flexed. That is, the body of the uterus is bent forwards relative to the cervix over here, and it is lying on top of the bladder, which you can see nicely over here. You can see that this is the fundus of the bladder, and the uterus is kind of lying on top of the fundus of the bladder. If you look here, this is basically the uterine canal. So this is actually the long axis of the uterus or the uterine canal, and right down below or posteriorly here, this is the axis of the cervix over here, passing through the cervical canal. And you can see a bit of an angle forming over here between the long axis of the cervix and the long axis of the uterus. This is the angle of anteflexion, right? So in other words, what we say is that the uterus is anti-flexed over the cervix. In addition, usually the cervix is anti-verted onto the vagina, right? So if you look over here, we can see that the cervix of the uterus is actually bent forward relative to the vagina, so that the cervix basically projects into the anterior aspect of the upper vagina and not really into the superior aspect of it. So in other words, if you look over here, see, this is the long axis of the cervix, of the cervical canal. This is the long axis of the vagina, and there's a bit of an angle forming over here. This is the angle of antiversion, and we say that the cervix is anti-verted on the vagina. So anti-flexion of the uterus on the cervix and anti-version of the cervix on the vagina is the normal positioning of the uterus and the cervix. Under abnormal conditions, sometimes the uterus may be retroflexed, that is bent backward at this junction over here, and under some less common abnormal conditions, the cervix may be retroverted, that is bent backward at this junction. The cervix, as we already discussed, is the inferior cylinder-shaped continuation of the uterus. The cervix projects into the superior part of the vagina on its anterior aspect. So the anterior aspect of the superior part of the vagina. The parts of the vaginal cavity which surround the cervix are the anterior vaginal fornix and the posterior vaginal fornix. Posterior is much bigger than the anterior one. The lateral vaginal fornices are much better visible on a side-to-side section of the female reproductive region. The cervix contains the cervical canal with a superior opening which is known as the internal os that opens up into the uterine cavity, and an inferior opening which is the external os that opens up into the vaginal region. The external os of the cervix can be seen on vaginal speculum examination, as the walls of the vagina are separated from each other with the help of a speculum. Now, we mentioned while describing one of the previous slides that the parietal peritoneum extends from the anterior body wall onto the different pelvic visceras. So we can actually see that happening over here. See, we're looking at the horizontal slice taken through the body, and we can actually see the pelvic visceras from the top over here. You can imagine the parietal peritoneum. You can actually see the parietal peritoneum extending from the anterior body wall, jumping onto the bladder, and then from the bladder it then goes onto the uterus, creating a little pouch over here which is known as the vesico-uterine pouch, and then from the uterus the parietal peritoneum peritoneum, then jumps over to the rectum and creates over here a deeper pouch, which is the recto-uterine pouch of Douglas. And then the parietal peritoneum continues with the posterior body wall. It continues underlining the posterior body wall. The same peritoneum extends laterally as well from the uterus to the lateral pelvic wall, and this double fold of parietal peritoneum, which extends laterally from the lateral wall of the uterus to the lateral pelvic wall, this is known as the broad ligament, which we can see over here, this yellow shaped region over here, which is the broad ligament, and that's also known as this is also known as the mesentery of the uterus. If we take the uterus and the fallopian tubes out along with the broad ligament, we can appreciate it much better over here. See this double fold of peritoneum, which is extending from the lateral wall of the uterus and going on to the lateral pelvic wall. Now, the base of the broad ligament is attached at the pelvic floor. So it basically goes down onto the pelvic floor and then extends backwards and anteriorly and continues with the peritoneum of the body wall. So the base is fixed down below. The upper margin of the broad ligament is free and it contains the uterine tubes or the fallopian tubes inside it. The broad ligament contains various nerves and vessels going to and from the uterus between its different layers, and also contains the ovary inside it and the uterine tubes, as we just mentioned. So the broad ligament can be divided into three subparts. The first part is the mesometrium, which extends from the lateral wall of the uterus all the way to the lateral pelvic wall. This is also known as the mesentery of the uterus, as we just mentioned. The mesosalpinx is the second part of the broad ligament, which is basically the superior part of the broad ligament over here, which suspends the uterine tubes. That's the mesosalpinx. The mesovarium is the third part, which is the posterior extension of the broad ligament, which invests over the ovaries. You can appreciate that a little bit better in this sagittal view, where you can actually see the uterine tubes running in the upper free margin of the broad ligament. This is basically the broad ligament over here, and you can see the lower margin is fixed, resting on the pelvic floor, and then it's a double fold of peritoneum. So then it continues anteriorly and posteriorly with the remaining parietal peritoneal lining of the pelvic cavity. And you can see this little region over here, which is the mesosalpinx, and then the posterior extension of the broad ligament here, which is investing over the ovaries, that is the mesovarium. We'll look at these in much more detail in 3D when we look at the prosections in the lab. Now, we mentioned before as well that the uterus is anteverted on the cervix, and the cervix is anteflexed on the uterus, on the vagina. So the anteversion and anteflexion is the normal positioning of the uterus, cervix, and the vagina, and the uterus is kept in its anteverted position with the help of a structure which is called as the round ligament of the uterus. This round ligament of the uterus is actually a continuation of the ligament of the ovary. So if you look over here, you can see that the inferior pole of the ovary is connected to the uterus with the help of this fibromuscular band. This is the round ligament of the ovary, and this round ligament of the ovary then continues as the round ligament of the uterus. The round ligament of the uterus then passes through the broad ligament, which was the double fold of peritoneum, and then it passes through the broad ligament, and then eventually it passes through the deep inguinal ring to enter into the inguinal canal. Then it exits the inguinal canal via the superficial inguinal ring and terminates by inserting into the labium majus down below over here. This anchorage basically helps to pull the uterus forward and keep it in its anteflexed, anteverted position. So as compared to the uterus, the cervix is a little bit more fixed in its position compared to the uterine body. There are different support structures. Some are muscular, some are ligamentous. For instance, if you look at here in this illustration, which is basically a cut section, a side-to-side cut section through the pelvic region, we can see the cervix and the uterus over here, and you can see that the cervix and part of the vagina over here, they're actually supported down below here by a muscle which is called as the levator ani, which is part of the pelvic floor. So this provides a support structure for these viscera to sit upon. And there are different ligamentous structures which stabilize the cervix as well, which can be seen in this illustration. One important groups of ligaments are the transverse ligaments, which are running in a transverse plane. These are thickenings of the connective tissue at the base of the broad ligament. We can see a transverse ligament here, a transverse ligament here. The broad ligament can be seen higher up over here, and right at the base of the broad ligament, we can see these transverse ligaments. These run in the base of the broad ligament around the uterine artery and extend from the cervix all the way laterally to the lateral pelvic wall. These are also known as the cardinal ligaments. Another important group of ligaments are the uterosacral ligaments, which run more or less in an anteroposterior plane, extending from the cervix, moving backwards, going around the rectum, and then inserting back into the sacrum. Weakness of these supports, such as in case of multiple childbirths, can lead to varying degrees of uterine prolapse. Right, so now let's talk about the uterine tubes or the fallopian tubes. Let's have a look at this picture of a prosection over here, and let's try to orientate this prosection first, and then we'll try to describe the uterine tubes in a bit more detail. So what I'm looking over here is the uterus, and I'm looking at the uterus from the back. Now, how do I figure out if this is the anterior or the posterior view of the uterus? Well, the thing which really works for me, especially when I look at the prosections in the cadavers, or especially when the prosection has been taken out, the thing which really works for me is this thing over here, which is the ovary. And if you look at the ovary, you can see that the ovary is posteriorly situated as compared to the fallopian tube, which is a more anteriorly situated structure. So when you can see the ovary clearly, then that means that this is a posterior view of the uterus. So now that we have orientated the prosection, we can see we figured out that we're looking at the uterus from the back, and we figured out that this is the ovary connected with the uterus through the ligament of the ovary with the fallopian tube or the uterine tube in the front. Let's talk about the tubes now in a bit more detail. There are two uterine tubes, as you can see over here, one on each side. Each uterine tube extends laterally from the junction of the fundus and the body of the uterus. So the part of the uterus above the uterine tube is the fundus, and the part which is down below is the main body of the uterus. The uterine tube then extends from the junction of the fundus and the body of the uterus and extends laterally all the way to the lateral pelvic wall. It basically opens up into the peritoneal cavity adjacent to the ovaries, close to the lateral pelvic wall. The uterine tube is divided into different subparts. The part which is actually inside the muscular wall of the uterus is the intramural part, that is the part which is inside the uterine muscular wall, and so we can't really see that part. Then comes the narrow part over here, which is known as the isthmus, and the isthmus then gets dilated to form what is known as the ampulla of the uterine tube. This is the tortuous dilated part of the uterine tube where the fertilization usually happens. The ampulla then continues into the fourth and the last part, which is this funnel-shaped ending over here known as the infundibulum. Infundibulum then opens up into the peritoneal cavity near the ovary. The infundibulum, as you can see over here, possesses some finger-like projections. These are known as the fimbria. The fimbria they facilitate the collection of the oocyte or the egg from the ovary into the uterine tube. And a Right, so now let's jump over to the ovaries. Each ovary is an oval shaped organ which is located near the lateral wall of the pelvis, just inferior to the inlet of the pelvis. The ovary is suspended by an extension of the broad ligament which is known as the mesovarium. If you look over here, that this is basically the broad ligament, which is the mesentery of the uterus, extending from the lateral wall of the uterus, extending laterally all the way to the lateral pelvic wall, and an extension of the broad ligament which is enveloping the ovary would form the mesovarium over here. Actually, if you look down below over here in this sagittal view of the broad ligament, we can appreciate that much better. See, this is the upper free margin of the broad ligament, which contains the uterine tube inside it, and you can see the broad ligament having a fixed lower margin resting on the pelvic floor, continuing with the peritoneum over the pelvic floor. And here we can see a posterior extension of that broad ligament which is enveloping the ovary. So that'll be our mesovarium. This is one of the ligamentous support structure of the ovary. Now, ovary is also held in its place by another ligament, which is known as the ovarian ligament, which we already talked about in one of our previous slides as well, where we mentioned a fibromuscular band extending from the inferior pole of the ovary all the way to the uterus, and that then continues as the round ligament of the uterus. And that is also responsible for keeping the uterus in its anti-flex, anti-verted position. Ovary has got a ligamentous support over here, which is the mesovarium, and another ligamentous support, which is the ovarian ligament. Now, like the testes, the ovaries develop in the posterior body wall, and then they descend prior to the birth into the pelvic cavity. As they descend, they bring their blood vessels and nerves and lymphatics along with them. These structures are, as they come from the lateral body wall, they are covered over by a double fold of peritoneum, and this results in the formation of another ligament. And you can actually see only a part of that ligament here, which is extending, which is a double fold of peritoneum extending from the uh, lateral abdominal wall. This is our suspensory ligament, or the infundibulo pelvic ligament. And it contains the various nerves and lymphatics, and various vessels which the ovary has brought down from the lateral body wall or from the posterior body wall along with it as it has descended down into the pelvic region. Another important relation, which we kind of have to know from a clinical standpoint as well, is that the ovary is very closely related to obturator nerve, which is running in the lateral pelvic wall. And so, a pain from any disease of the ovary is often referred to the medial aspect of the thigh, because that is also innervated. That region of the thigh is also innervated by the obturator nerve. The vascular supply to this region comprises of ovarian, uterine, and vaginal arteries. The ovarian and uterine arteries anastomose with each other as well. Now, we all know from our knowledge of embryology, and as we discussed in a previous slide as well, that ovary is a retroperitoneal abdominal organ, and it normally then descends down into the pelvic cavity before birth. As it descends, it drags its blood supply along with it as well. The ovarian artery, therefore, arises from the abdominal aorta, which you can see over here. You see the abdominal aorta here in the IVC, inferior vena cava, and the posterior body wall. The ovarian artery can be seen arising from the abdominal aorta over here. Each ovarian artery then descends downwards and laterally on the posterior abdominal wall. It then crosses the inlet of the pelvis and then travels down inside the suspensory ligament of the ovary, which we, as discussed, was nothing but a double fold of parietal peritoneum, which is kind of pulled off from the posterior body wall because of the vessels which are being dragged down by the ovary into the pelvic cavity. So the suspensory ligament is a double fold of peritoneum which contains these vessels going to the ovary or coming from the ovary. The ovarian artery then enters the broad ligament of the uterus. So from the suspensory ligament is going to reach all the way to the ovary, which we can see over here as well. See, this is a lateral. This is actually these are the reproductive organs taken out of the body, and you can see the ovary laterally related to the uterus over here, and you can see the suspensory ligament is going to be coming in from the lateral body wall over here, containing the ovarian artery and bringing the ovarian artery onto the ovary. The ovarian artery now has entered into this region where the broad ligament is present, and here it anastomoses with another artery which is known as the uterine artery. The ovarian veins on the right side, they drain into the inferior vena cava. So you can see that here, the right ovarian vein passing through the suspensory ligament along with its arterial counterpart draining into the inferior vena cava. However, on the left side, we can see that the ovarian vein doesn't drain into the IVC. In fact, it drains into the left renal vein. So there's a difference in terms of the drainage of the ovarian veins on the right and the left side. The arteries, on the other hand, are both coming off from the abdominal aorta. Now, the second artery which is worth talking about is the uterine artery. The uterine artery, unlike the ovarian artery, is a branch of the internal iliac artery. So you can see the abdominal aorta splitting up into common iliacs, and the common iliac splits into external and internal iliac branches. The internal iliac artery is going to give off a branch which is the uterine artery in case of the females. The uterine artery, it can be seen over here running medially in the base of the broad ligament, reaching on to the cervix. So this is more or less the junction of the cervix and the uterus over here. On its course, you can also see that the uterine artery crosses over the ureter. So the ureter is basically a very important relation of the uterine artery, and the ureter can be damaged during hysterectomy, which is the procedure of removal of the uterus, where if the surgeon can actually accidentally tie the ureter along with the uterine artery, and that could actually result in a patient presenting with post-op complications such as hydronephrosis. Now, on reaching the cervix, the uterine artery then ascends in the broad ligament. So it's still going to be inside the broad ligament, but it gives off ascending and descending branches. The ascending branches, they ascend on the lateral on the lateral side of the uterus inside the broad ligament. These then run on the inferior aspect of the uterine tube inside the broad ligament and anastomose with the ovarian vessels. The descending branches can go down and and supply the cervix and the anterior and posterior walls of the vagina. This anastomosis is really important to know about, because the anastomosis between the uterine and the the ovarian arteries has a huge clinical significance to it. An ectopic pregnancy that may occur due to implantation in the mucosa of the uterine tube instead of that of the uterus. And as that ectopic pregnancy develops, it grows into the wall of the uterine tube, and it can eventually erode the vessels in this region of anastomosis, which can result in a severe hemorrhage into the peritoneal cavity, which may be fatal unless treated. So, knowing about the existence of this anastomosis has huge clinical significance to it. Unlike the uterine arteries, the uterine veins, they begin as venous plexuses around around this region over here. Each uterine vein that is then going to drain into its respective internal iliac vein. The third artery, which is worth mentioning, is the vaginal artery. The vaginal artery is a branch of the internal iliac artery and is equivalent to the inferior vesicular artery in case of the males. In some